But high 10 o'clock, so we will jump in and get started. I would like to thank Jim and Panos for being here with us today to tell us a little bit about some of the work that they're doing and how it might be beneficial to the work that you are doing. So, Jim, with that, I will turn it over to you to share information.
Awesome. Well, thank you everyone for taking time out of your day. As a person who lives and breathes in public education, I know that your days are busy, and to take out time is an expense. And our hope is this morning that it'll be well worth your time. My name is Jim Simney, and Panos will introduce himself in a minute. But just I wanted to give you some context of who I am and why I'm here and why I believe in Dawn Health. We'll get into the nuts and bolts of Dawn Health, but it's really a wellness, non-pathology based family mental health support system. And I've been in the field for 32 years. And I currently practice at Rosemount High School in District 196. And I've been there for about 5 years. And prior to that, I spent 18 years in our district at two different elementary schools. Full disclosure, I need to let you know that I'm here today after taking a half personal day. I'm just very clear with ethics. I don't want any misrepresentation of how my time's being used, but this is my personal time. And a little bit more about me. I'm a dad of three. I have a 21-year-old son, a 19-year-old son, and an 18-year-old daughter who's at Rosemount High School her senior year. My professional journey is not only school mental health, but I have 15 years of emergency medicine experience at Fairview Ridges, Southdale, Fairview Riverside, Minneapolis, as well as doing telemedicine for the whole state of Minnesota. So there's probably a good chance that I may have interacted with a student in your district if they've had a psychiatric situation and Fairview was the provider for them. Other experiences, child protection, residential treatment, adoptions, teaching at University of St. Thomas, as well as providing corporate and collegiate mental health. But why does that matter? We know in public education right now, we're strapped with the resources and the finances. And our goal today is just to give you some background about what our company can offer and how that can hopefully improve the social, emotional, and the well-being of not only your students, but the whole family system. So at this time, I'm going to turn over to Panos, and he can share a little bit about his background and his vision for Dawn Health as well.
Yeah, thank you, Jim. Appreciate you, and good morning to everyone. So my name is Panos Efsta, and I'm the founder of Dawn Health. A little bit about myself. I'm a dad of three. My wife actually is from Montevideo, Minnesota, so we spent a lot of time there, of course, during the winter time, so we can enjoy some snow. Currently, we're living in Texas. I've spent several years in the healthcare industry, and I would say the last 5 in mental health. And really, Dawn Health is a child of me seeing all the deficiencies when it comes to adolescent mental health and the involvement of parents in the child's journey. Unfortunately, the system we live in and operate in is treating mental health for children the same way we would treat any other disease for an adult. And we've seen that, the results, unfortunately, are working against us. And I say that because, we as a community, right, whether we have kids or whether our kids are, directly affected with mental health challenges, is that, our neighbor kids might be, their school friends, their school classmates might be. So that's why we have this vision of really evolving and transforming how we approach mental health, not really as a pathology, but as a wellness opportunity. And we have been working for this, very hard for the last 5 years. We are part of the Harvard Innovation Lab, and we have worked with Mass General to really get this idea from the ground up, right? And be here today and be able to showcase you, what we can do and what we're going to be continue doing in the near future. So mental health for me is near and dear to my heart because I'm an immigrant. I came here at 19 years old with no support, with no family. And as you can imagine, the transition from a different country here was very, very difficult emotionally. And if I had the opportunity to go back in time and had the resources available to me that I can have today, of course, my journey would have been much easier mentally. So, Jim and I go back several years. We have worked together in the telehealth sphere. So what we're going to showcase you here and what we're going to share with you is not dreams and hopes, is actually reality. And we will showcase you really how we can partner together, not just for the benefit of your individual school district and school, but really of our communities. Because if we don't start addressing health in a community standpoint, we're never going to win. And when I say win, meaning is making sure our children have a better life than we have. So with that said, I want to quickly turn it over to Dr. Lauren so she can introduce herself, and then we will proceed.
Thanks, Panos. Thanks, everybody, for having us. Yeah, I'm going to let Panos and Jim they've kind of done the bulk of the work here, but thanks for having me. I'm excited to be here. I'm excited to be a part of Dawn Health. I'm a pediatrician. I was in private practice in Southern California. I lived in Hong Kong for about 9.5 years, raising my 4 kids. While I was there, I actually worked with a woman and became really dove into conscious parenting work. And so I became a parenting instructor. I mean, that was really the bulk of a lot of what I was doing in Hong Kong. And with becoming just doing all the work in conscious parenting and mental health, it really just gave me more insight into how important just comprehensive look at child wellness and just our whole society in general, and really getting that. And so when I came back to the United States, it was right in the middle of the pandemic, and I was just shocked at really what was going on here from a metabolic health standpoint and a mental health standpoint, especially with kids. And I worked with Dr. Chris Palmer out of Harvard for about a year on his brain energy movement. That's how I ran into Panos, and I really become very, very passionate about just how we're approaching focusing on kids and mental health and the intersection with metabolic health, and how we really need to bring all of that together, along with giving parents the skills to be able to navigate all these complex issues that we're dealing with, and also empowering kids with ways of communication, how to resolve conflict, building up their self-esteem. And it just can't be a one-sided approach in my mind. And so our focus on sick care here has really driven me to just more of a preventative care model, which is when I talked to Panos, gosh, it's been a couple of years, about how just this really was like, okay, this is how we need to go with kids. We got to teach them how their bodies work. We have to teach them, how to manage their anxiety. I mean, my 10-year-old daughter, she does breathing, she does breath work before she goes to bed, because she feels really anxious right before she goes to bed, and she'll do breathing, and that calms her down. And just knowing that that's okay. And really steering away from this knee-jerk reaction that a lot of that seems to be to medicate kids. Not that there's not a time and a place, but I feel like there's so many other avenues we could go. So I'll stop there, but thanks for having us, and I'm looking forward to collaborating and really improving our mental and metabolic health for kids and their families.
Thanks, Dr. Lynn. I appreciate you. I'm going to pass it back to Panos right now. And I should have asked, I apologize. I assume you can see the screen share from all of your monitors. I just want to make sure. Okay. So I know we've already talked about our introductions. One little tidbit I'll add to build off of Dr. Lauren is we're non-pathology based. We're not waiting for things to get worse. We're coming in to lift up and assess that family unit and leverage their strengths and build up the family unit for better tomorrows. I spent 15 years in emergency medicine. For those of you that have been in the ER, you know how that works, and you know how it doesn't work in the long run. So we are not about that. We are all about lifting up and leveraging the strengths. So I'm going to turn over to Panos right now, and he can take it from here.
Yeah, thank you, Jim. So, I wanted to, break the ice a little bit, right? This is a joke that my wife had shared with me. So, we have a 4-year-old almost daughter, and we asked her to, one day to grab the phone book. And we had, moving from Minnesota to Texas, we brought my wife's, old school stuff, and including a phone book. So we said, Evelyn, go grab the phone book. She started laughing because, she was holding, she knows these kids know nowadays how to play with a phone, right? Better than we ever did. And actually, even now. So, at the end, mommy wanted to kill a spider. We have plenty of here down in Texas, but unfortunately, we used the phone for that, not the phone book. So anyway, so with that said, one thing I want us to really understand is that if we treat our kids that like they're sick, then we're putting a stigma to mental health. And I think you have all realized that the more we stigmatize mental health, the more likely are for parents not to do anything about it. So then now we have, a two-headed monster to fight: the challenge itself, but also the stigma that comes with it. So, in some numbers that I want you to keep in mind, that 94% of parents who get the support from a system, they feel more equipped to deal with those situations with their children. And that comes from the American Medical Association. And on top of that, 25 to 45% of the students that they receive the mental health support that they need are more likely to improve their GPA and also not drop out, which of course has direct impact to every school, private or public, anywhere in the country. And last but not least, the average cost per student per year is $10,000 for untreated mental health symptoms that the child will carry throughout the school year. So it's not about, I want us to make sure that we understand, it's not really about the treatment. It's all about the whole system that goes with it. And Jim will explain really the differentiating factor than taking your child down the street to a mental health clinic or seeing a therapist at school.
Yeah, well, thank you, Panos. I appreciate that. We talked about the why a little bit, but give you some insight. I had the privilege of working at Shannon Park Elementary for 18 years, and that's a feeder elementary school into Rosemount Middle and then Rosemount High School where I'm at. I've had the privilege of reconnecting with kids that I used to playfully have to tear them off mom's leg at kindergarten drop-off. And I had the privilege of teaching in their classrooms, kindergarten through 5th grade, around social, emotional wellness and health. And then the greatest gift was reconnecting with those young adults now in the halls at Rosemount High School. One thing I can tell you anecdotally is those that have those support systems, I see them thriving in that high school right now when I go there. And I can tell right away where the depletions are. And that was detectable back many years ago, and trying to plug a system and support system with reactionary measures. I'm living proof at Rosemount High School of a small population of kids that it just doesn't work for. So my why is I live in Rosemount. I'm sitting in my office in Rosemount. I shop in the stores where these kids go and they shop. I'm neighbors with their parents and their families. It's highly valuable to me that I build my own community up, because I'm a father, a professional, a husband, and we all benefit when we come at it from a holistic, non-pathology model. So one thing that we'll talk about a little bit later is some differentiating factors. Dr. Lauren talked about this already. We are family-based. It's a mandatory participatory piece or guardian, whatever that is for that child. We're also metabolically based. There's no other system out there that looks at metabolic health, and we'll explain that in a little bit, but we're looking at it from a two-prong approach to constantly keep that family engaged and that child and adolescent engaged with trackable data and outcomes so that we all know where we are currently, where we want to go, and how are we going to make that happen. So I'm going to kick it back to Panos here to talk a little bit about quality excellence and our commitment to that.
Yeah, thank you, Jim. So some key points here that I want you to keep in mind as we move forward. So our focus is really primarily two main states, Minnesota and Texas. And that's because based on what we have seen is there's a dire need of services, right? Especially in the rural and the suburban areas. You know, the metro areas typically will have a lot of options, right? Of course, more expensive. But really what happens in Montevideo, Minnesota, right? What happens, when you go to, here in where we live in Hawkins, Texas, a small rural village. So far what we have accomplished is we have been an approved vendor from the Texas Education Agency. That means that parents that they get state grants, they can use those grants to pay for services at Dawn Health. We also part of the Harvard Innovation Labs. And what does that mean is, really, we're working with resources within Harvard University, including Mass General, to really reinforce the quality excellence of our system. And it's not just clinical, it's also operational, making sure that we provide the family experience that a family needs to transition from a difficult and challenging time to a wellness status. Also, something very important that it takes, I would say it's related to what we're going to share later on, is that we're working with the Indiana University School of Social Work very closely in the last 6 months to apply for federal grants that really is going to allow us, as we're partnering with every school and every school district, to provide true equitable access to health. Equitable access to health, to me, as a parent, is not just everybody has access to health, and in this case, mental health services. Is making sure that those that don't have the privilege, they don't have the support, the resources that they need, they get those resources that they need. Not everybody needs the same resources. Not everybody needs the same access. And that comes to play as how we have designed Dawn Health to be, to make sure it's personalized to every single family, to every single child. Because you cannot help a child unless you also help them within the environment they operate day in and day out, which is their family environment. However well structured or however broken it might be. Similar to, probably you will see it when it comes to student teaching, right? Every student learns differently. So the cookie cutter approach doesn't work, right? So that's why, it's important to personalize this approach. And what we have seen is that a lot of times the children carry the problems of their parents. So that's why it goes back and reinforces what Jim said, that we are approaching this holistically when it comes to the family. The parent is involved. They have no other options. They cannot just drop off their kid to Dawn Health or another clinic and say, you deal with it, therapist, while I'm sitting outside and watch TikTok or being on Facebook. No, you're actively involved, because what we found out is sometimes the parent needs therapy more than the child. And when I say therapy, this is not just a negative notation to therapy, right? It's really improving their parenting skills, as Dr. Lawrence said, because most of the time, we as parents don't know how to manage those behaviors from our children, because we were managed differently, and what we carry is heavily biased. Jim?
Yeah, thank you, Panos. I appreciate that. So I'm just going to move through this really quick, and I know that you can scan the slide, but whether we're thinking pre-pandemic, during the pandemic, or post, we know that mental health has obviously come to the front door of every one of our school districts and in our community, in the residences that we live in our neighbors' homes. A lot of people get, I think, burdened by the increase in the numbers. And yeah, they have spiked, don't get me wrong. But I tend to look at it as a really incredible opportunity, because I know from my experience in working with students at Rosemont High School during the pandemic and their parents, it really forced them and maybe even myself to really look at myself in the mirror. I didn't have the distractions of this, that, and the other, going here, doing that. Whatever it was that we filled our days with superficially, we were left with nothing but ourselves in that mirror. And as a result, yes, we've seen numbers go up, but that ownership and that recognition, I think, is a huge asset that we can leverage, and one that I sell heavily at Rosemont High School. That now that you're aware, you can do different, and maybe you get to decide you can do better. It's not for me to sit and throw in a judgment, but now you have a wider scope of awareness and a lens of potential. So I look at these numbers and they're valid, and they're concerning, but I also want to flip it to the positive, that it has a lot of potential for us to lift adolescents and teens in the most tumultuous time of human development into a brighter space, not of perfection, but of growth. And that's key, that we sell that to our kids and our students, that growth is always a potential. So I'm not going to insult you and go through the numbers. You can see that at the bottom, insurance coverage for families in Minnesota is pretty high. And in our service, and our model aligns with that in supporting PPOs and trying to maximize the efficiency of what we provide at the least amount of a cost for the parent. So Panos, back to you. We can talk a little bit about or myself, I'll keep this one, my fault, I apologize. So our solution, what do we have? I'm going to show you a screenshot in a minute, but we have a referral process that's seamless. It's right on our website. It takes less than 3 minutes for a school nurse, school counselor, principal, superintendent to fill out. That goes right into our queue, and we have a robust system with an immediate response within 24 hours. And that's our ethical responsibility. We want to pride ourselves on lean, efficient, high quality services. The big catch for all of you is literally it's no cost. We're not here to try to over or undersell something. We have a co-located model of mental health support in our school district because we can't afford the FTE to staff at the levels in which we need that by no fault of anyone's. And there's grant-based in collaborations, and we make it work. I believe what we can offer is a lot more robust actually, but it's at no cost to all of you. Panos talked on the health equity focus. We want to lean into the resources that we can go out and reach and grab, or that all of you may have, or that families can access themselves to provide Dawn Health in their homes if they're interested. One of the key pieces that I think is advantageous is that we have minimal delay. We've built a system on metrics to calculate acuity level need, and also we have the staff and we have the clinicians. We have nationally certified health and wellness coaches, the highest level attainment to talk about metabolic health if there's a metric of concern. And we have only the highest level of clinically licensed clinicians. No negativity being projected towards someone who doesn't have that. But we feel if we set the bar highest for ourselves, that's going to provide the best outcome and the best leverage for the families to trust us to care for them and their child or children. And then also supporting community wellness. We're all about the big picture, the macro level, while supporting the micro need and holding both of those virtues in equal status, never compromising one for the other. And feel free to interrupt if you have questions. We'll have time at the end, and I promise we will not go anywhere near 11 o'clock. But I just want you to know that you can interject at any point in time. Panos, why don't you talk a little bit?
Yeah. And on top of that, I wanna really reinforce in the previous slide the no cost to school. Because Jim and I have had, experience in the mental health sphere for several years, and in secondary and higher education. What I will tell you is there's models out there that they will come to your school district and ask you how many children do you have? X. Okay, great. You will pay a Y amount per child per year, and then you will get free access to health. What I will tell you is this model hasn't been working and it will not be working for two reasons. One is that's not equitable access to care. Not every child needs the same resources. Number two, you will come across with your school district CFO the discussion as to, we're paying this vendor so much money every year, are we utilizing them? So and then you're gonna have to go back and say, okay, vendor, how many sessions have had, our children have here, how much is the system is utilized? And you will keep on, I would say, not necessarily fighting, but you're going to have to work yourself with the vendor and find out, okay, this is a great service, but we're not utilizing it, right? So is it like a nice to have, or is it necessary to have? The money that you would spend for a group of students that they will not necessarily use or need to use the system, why not save? And then if you ever want to fund a low-income families access to health, you can do that. That's why we do what we do and the way we're doing it. That's why we even go out of our way to raise state and federal funds to help those families that they might not necessarily have insurance, and maybe those families that do have private insurance, but guess what? It's still expensive for them. So what I would say is, for the slide that you have in front of you, as Jim said, we only use licensed independent providers. We don't have associates. All our providers have a master's degree at a minimum and at least 3 years of experience. They have their state license approved before they come to work for us. And that's important because, who you have across you to deal with your child or yourself is really important. If they don't have the necessary experience, education, and certifications associated with it, you're not going to get quality outcomes. Also, something that is really not obvious at first. We are not a 9-to-5 clinic. And that's important because what happens between 9 to 5? Parents are at work, students are at school. We're not going to support a student that leaves this class to have to go to a clinic to get the session that they need and then go back to class. On top of that, how about the parent? Now we're forcing the parent to take off, from work, have to drive the child anywhere. We said no more of that. Our system is there for the families on after hours. So when you pick up your child or you get back home from work, you can hop on in front of the computer, in front of your phone, and have a session individually as a parent or as a child or as a family. And even on Saturdays. This way, we don't want kids to miss class to go to a session. Because even if a resource is available to them at school, sessions are not a 15-minute session, right? Those are a 45 to an hour-minute session. So as you can imagine, no break time is that long as far as I know from my time at school. Very, very important also, the parent is always involved. It's part of the process. What does that mean? The parent knows what's happening, collaborates with the clinical team, which is the assigned therapists, the assigned health and wellness coach, Dr. Lauren, Jim, who are the supervising folks of our clinical team, because this is a holistic approach. They're part of the process. They're not getting to step away and say, this is my child's issue to deal with. They're part of it. And you will find that this is very rare to find in any clinic that you go, right? Because unfortunately, the last several years, our country has gone through a huge transition and confusions and whatever you want to call it. But we want parents involved, right? There's no reason to separate the parent from the journey, from the child. Last but not least, as going back to zero cost to the school, our referral process is seamless. So your nursing staff or your clinical staff at school can work with our team very easily and seamlessly. So that when they make a referral on our website, they can even, that's what goes back to wasting your funds too. They can select if the school wants to support that family financially during that journey. When we have a relationship with you, an official relationship with you, then of course we're not gonna wait until we get paid first. We're gonna handle the family and then work with you on the financial piece on the side and afterwards. But then the school staff will also know that, hey, by the way, we handle that referral, and sometimes they might need to be involved. The school also is a key part of the student's life. We have the ability, if you have a local therapist, like in case of Jim's district, and they have been handling the child for a long time and they want to transition the child off, it's a seamless transition off. It's not like, buy Jim and welcome down health per se. So this is very important because how we handle that journey is very important. 50% of mental health issues, they're coming to light at the age of 14. That number goes up to 85% at age 17. And as you can imagine, those are the junior high school years, right? A lot of pressure, coming very close to, real world in a few years. So that's the right time. If we want to address the adult mental health crisis that we're facing today, we need to address the adolescent mental health status today.
Great, thank you. I appreciate that. And, I'll segue into care progression on our last and final slide, just so you have an idea of the time left that we have with you. We have a fully integrated web-based app system that is based on care progression. And what does that mean? I would implore any of you, with all due respect, if you have a student that has an in-school therapist or an outpatient therapist, to ask that therapist, how is that student doing? And when they say fine or better, ask them, challenge them to say, prove it to me, show me that. How did you get to that point? What we offer is a care progression system that involves the adolescent, every parent guardian in the home, and every 2 weeks, we send out an assessment that's very, very brief. And all parties in that home complete that independent of each other. And it's written at a 4th, 5th grade level. And with the use of technology with teens and adolescents right now, we find in our research that it's very, very applicable and easy for them to navigate. But what it gives is 3 or maybe more, or maybe 2 voices from that adult level perspective in that home and the adolescent. That all those data points are put behind the profile of the student and our client. And that churns out what you see here, the different metrics that we have access to help guide our clinical interventions, to help celebrate. I think that's one of the lost essences of therapy. We have a very deficient mindset where we're coming in to fix something, and once it's fixed, then we're done. I don't work from that mindset. I'm strength-based, and I'm looking to celebrate and lift up. And every data point that elevates functioning or reduced risk or reduced dysfunction, that's my responsibility to call that out on this visual as well as verbal with the clients, with the adolescent teen, and with the parent guardian on that session with me. So this is a very, very robust system that allows them to make appointments, edit appointments, care progression, and it's many different spokes in that wheel that give a comprehensive, data-driven, evidence-based answer to the question of how is my kid doing, rather than the traditional response that I guarantee you 8 or 9 times out of 10, you're going to get from a therapist that says they're doing better or they're still struggling. That doesn't tell us anything. We have 0 to work with, and the chances of improving the functioning, whether it be attendance, anxiety management, behavior, academic achievement, we instantly have reduced our chances of doing that by 80, 90%. This gives us evidence, truth to work with, and then fuel progress, growth, and celebration. So with that said, I know we've went through a lot. We want to honor your time. It's 10:34. We have the stage until 11. I made it clear to Lori, we are absolutely not going anywhere near 11. I want to honor your time, but is there any questions or anything that we can clarify or better explain to give you sort of a really basic understanding of what Dawn Health is?
I have probably a couple questions. But first, just to start, I want to say thank you for sharing this approach to mental health. I think it's for me, I'm also not an educator, I'm an architect by training. So I bring kind of a different lens to it, but also a parent. And I really appreciate the family focus. My child is in outpatient therapy and I don't get that touch point, you know, how do we help with this? What's our role as parents? So I really appreciate that first and foremost. One of my questions for you is, how do we get schools to even be aware of this service that's available? I know you mentioned rural schools are one of your main focus. I live in the city, so you know I see the major disparities that we have and the insufficient mental health supports for our students in urban environments as well. And I'm curious how we just educate our own districts as a parent, as family, that this is available.
Yeah, I appreciate that question and thank you for posing it. I think, you know, a couple angles that we've taken is the, you know, traditional hoofing it and dropping stuff off at schools and district offices. I've also outreached to obviously MASA, MESPA as well, in trying to be intentional, but also compassionate to the forces that all of you and all of us are dealing with, is that we get barraged with a lot of opportunities, a lot of things that come through our inboxes or maybe our fax machines. Believe it or not, people still fax. I get stuff all day long, and it's hard to really sift through. Is this really worth my time? Is it worth my time? So, you know, our intention is to build solid, truthful, respectful connections with small pods of people. Let us do our work and let that speak for itself, and that will that'll ooze out for all the right reasons. You know, I don't think we're of the mindset to really campaign or flood a market. We've seen major health, telehealth, mental health corporations do that. And I won't call them out on this platform because it would be disrespectful, but we see them fold, or they have to really realign and redistribute their assets, which are depleting. And now they're faced with monumental questions of survival because they overinflated their estimates or maybe went too far with their reach with a grandiose idea that didn't have the long-term sustainability. We're not of that mindset. We're starting small and trying to build those trusting relationships. So I'm going to continue to knock on those doors, and also, you know, try to be intentional to plant a seed of knowledge. If any of you feel that it's worth learning more, and I can schedule a time outside of my contractual hours, or Panos or Dr. Lauren, we're happy to do that. If you want to bring other people in, we're just looking to build respectable, truthful relationships. And I think that's our best marketing tool to create awareness in our communities in the state of Minnesota.
And to add to that too, that's why we're here today, right? We had the you know, the blessing to be able to do that through MASA, but we're trying to go in a way door to door, because we're now going to advertise to the whole world, because we know that nobody can support that, right? So if we as Dawn Health were to support, you know, Minnesota, we want to make sure that we are able to support it, because one thing that all of you and all of us as parents do, we should be always asking a provider, whether they're a physician or a mental health therapist or, you know, a coach, is what is your workload? Because we all know here is, you know, the more workload, you know, they have that they can handle, eventually is going to deteriorate the quality of care that our kids or we receive. And we're very careful with that. And the team that we have and the way we're managing that relationship is making sure that from patient 1 to patient X that can handle on a weekly basis, the experience is the same. The quality they deliver is the same. We don't overload our clinicians. We don't believe in the mindset that, you know, you charge, right? See as many patients as possible, so, you know, we can make money. That doesn't work with us, because we want to make sure that we have a long-term relationship. Like, for example, Jennifer, you mentioned that your child is in outpatient care, right? So imagine having that relationship from early on with us until they graduate, you know, high school, and they're ready to go to college. They will go there far more equipped, to face, real life away from you. And the same thing, you will feel also more confident. Right now, you gave me the vibe that you were not necessarily, necessarily as confident with the outpatient care. So that's why the educational piece is a key element of our system. So, and Jim touched a little bit on that. Every week there is an activity that takes less than 5 minutes for both the parent and the child. The 1 week is clinical, where we have evidence-based assessments where you give us the perspective, your perspective of your child, and the child gives us their perspective. What do you think that's going to reveal? Your weaknesses as a parent, and also making sure that you understand what your child's status truly is, because you don't today. Today is very subjective, right? The same way, the following week, we provide you an educational piece. It's a 5-minute read. You read it and you give us your thoughts. The same thing, your child reads it and gives us their thoughts. Then this is information, quantitative and qualitative, that a therapist has on a weekly basis. So whenever you meet with the team, they know more about you and your child and your relationship and your perspective than anything. Probably you have that understanding of yourself, right? And that's the whole idea, is to reveal opportunities, not to tell you that, oh my gosh, you're a bad parent. Absolutely not. This is what you're missing. Let's work on your parenting skills. Or you know what, you're carrying some drama that has an impact on your child. Let's work on you so we can also help your child. The center of everything is the child, right? So we have to work on their environment as well as on themselves as well. And this is not going to happen just with clinical therapy. It also happens with education. That's why the key part is that we have here that says family engagement. Your activities on the platform and your engagement as well as your child is tracked. This is the data that we don't just see, you see as well. You see the progression of care. So if you say my child had a meeting with Jim X day, you'll be able to see what happens after. Are they improving or not, right? And then we also score your engagement. So at the end of the year, we say, hey, you are highly participating on this journey. Let's enable you. Let's celebrate your journey this year, right? Let's send you to Disneyland, as a family. We want to make sure that we're not just seen as a mental health organization. We're also an educators. We also, a tech company, but we also want to make sure that we are family, right? Because we're parents ourselves. So we want to make sure that the way we're going to be treating our children, we treat everybody else's children in a good way, of course. So Jennifer, I hope we answered.
Can I add something into that, if that's okay?
Sure.
Thanks, Jennifer, for asking. Just kind of piggybacking off of what you said. For me, this is so crucial, and I've seen it over like the 11 years that I've been doing the parenting work, is that we have, as parents, we come into this parenting with really very little skills, right? We're coming from our own generational trauma. We're coming from how we were raised, right? In all these ways. And so we're kind of, for me, at least my experience is like, we're thrown into parenting and there's just very little, skill building around it, right? It's either societal pressure on how you're supposed to be, how you were raised, and all these different things. And so for me, this is such a crucial, this is so important, and I can't stress it enough, is really helping parents unpack what's going on for them in order to show up better for their kids, and to do it in a way that aligns with them and supports their children. And I mean, I'm just working with I've been involved in the first responder community, and I'm working with NYPD officer, and she said, I know this isn't the way I want to parent. I grew up in a household that was chaotic and screaming and traumatic, and I find myself doing that because this is just this way of being, and how I don't know how else to do it, and I know this isn't how I want to do it, and I have no idea how to shift. And so we're working on shifting how, unpacking that, and working on just her obtaining all these new skills so she can show up better for her kids. And that's such an important point for me, is just teaching parents how to communicate better, how to resolve conflict, how to all these tools that I've learned over the years, and I'm still learning. in order to, I think Panos had mentioned, in order to equip you to be able to handle things moving forward. I have 3 boys, and my daughter is, you know, a whole different ball game for me. Thankfully, she's my youngest. My sons were not as complicated in the sense of now, but I do feel like, okay, I don't know what adolescence is going to throw at me with her, but I feel more equipped. I feel more grounded, that I'll have at least the skills to move forward. I'll still have to learn new ones, I'm sure. So I just feel like that is such a crucial point in this, and that is going to make it just, you know, kids thrive better, families thrive better. And I've just seen so many families transform, and parents actually improve their relationships with other people, with their kids. And also, you know, on a side note of the metabolic health part, is we can't ignore that either. We can't ignore that sleep with kids. You know, kids with sleep issues tend to have behavioral disturbances and all that. We can't ignore that piece too. So you know, I won't get into all that, but, you know, nutrition and movement and social media and all those things, and how to navigate that as a parent, and how to be able to influence your kids without a controlling form of discipline, which we know leads to this rebellion and all these things. So it's just, yeah, it's a lot. And that's what Dawn Health really encompasses, is approaching it from, you know, seeing the big picture, and then navigating these different areas where you're struggling, and supporting the families and the parents in all this. So I'll stop there before I go off on but it's also education too, education about all these different things, also education about medications. I mean, that's a passion for me too. So just to be like, the medications that kids are being put on, just being aware of the side effects, being aware that this affects metabolic health, being aware that these are not always really that effective in a lot of ways. So that's another part of this as well.
Thank you, Lauren.
Thank you. If I could just follow up with one thing, I really appreciate all this, especially the focus on conscious parenting, as you mentioned. It's more about the parent than the child. That's why we call it parenting. And just to kind of maybe plant a seed, I feel like parents are the ones who really need to hear what you are about and the services that you're providing. And so if there's any way that you could engage with parent groups of particular schools or districts that you are working with, I feel like that might give you even more traction within certain schools. And not sure if you've kind of gone that route too, but
Yeah,
just
no,
That's a great idea.
Yeah.
That's why we're starting this discussion with the schools. We try to do, of course, our, you know, a little of marketing to parents, right? In you know, I would sound like you know, a little awkward here, but we're using digital marketing, right? Digital marketing methods, you know, to get to parents. But, you know, we all can see now the effects, the negative effects of social media, right? You know, to kids. So we want to start with the school. So, you know, because they have, I would say, a longer relationship, lasting relationship with parents, and then become a trusted vendor to each one of the schools that you know, we can partner with, and from there build the relationships, and of course, you know, grow from there. We already have some relationships established in Texas and locally here too, with school districts, and we provide them our marketing brochure, where, you know, if a nurse or a staff member wants to refer a family to us, right, they give that brochure to the parent, and then they also enter the referral. So this way we don't lose that information, right? So we can also reach out, because as you can imagine, it's almost like buying a car. You know, you want to think about it a little bit, right? Because it's like, you know, I want to wait for it, you know, think about it. But what I would say is this: one thing that we are not aware as parents, and when I talk right now as a parent more than I would talk about, you know, as part of Dawn Health, is when we hear, "Come to me and I have a solution for everything," that's a big red flag, right? No organization on their own will be able to offer any school every single medical service, which is the pediatric service, the mental health service, the psychiatric service. Those companies is what Jim was referring to, that actually start folding because operation is very expensive, right? And number two is the quality deteriorates. We saying we want to partner with you as a family early on, so you don't have to see your child in inpatient care. Because once he goes to inpatient care, I will tell you, and I'm pretty sure Jim and both Dr. Ronnie can vouch for that, is the harm done to the child once they're in inpatient care, meaning that you have taken your child to the emergency room and thereafter, is far more dramatic. It's far more impactful than anything else this child will go in their lives, right? And that's why we say work with us early on. So we can work. Yes, there will be, because we're talking about personalized care, there will be cases where, different type of care, like psychiatric help, is necessary. We don't say no to that, but it's going to be a process, right? So we're working with you as a family. Then if we need to refer you to a psychiatrist, we're not going to say, okay, well, go find a psychiatrist. We're working with you to help you, making sure that we manage the relationship, because a psychiatrist is not a therapist. A psychiatrist is going to do medication management, right? You still need the coaching and therapy piece. Just because you're putting a child into pills does not mean your life is better than the very next day.
That's a great point, Panos. And I'll just add really quick. I know we're running out of time, for all of us educators out here, we live and breathe FAPE, free and appropriate public education. We use the visual, or at least we think of the visual, I hope we do, from least restrictive to most. And, Dawn Health mirrors that principle as well. We want to start at the least restrictive entry points and leverage the strengths rather than leapfrog all of those elements that Panos just described, partnering with the family, parent education, coaching and wellness and metabolic health and adolescent therapy, family therapy. All of those are stops on the train line that we should try. We should try before we get to the most restrictive elements over here, which are medication and inpatient care. Now, obviously, if there's an acute high-level risk, that is leapfrogged and we need to, safety always wins, but we don't want to use that as a quick out or a card to play when we know the best work is done in the least restrictive environment, because it has the most long-standing positive skill building effect for the adolescent who's going to grow up just like us. And on this call right now, there's 2 people statistically that have a mental health diagnosis. And whether we're managing it well or not my business. But if we're not managing it well, my guess is we weren't taught those skills early on. And that's what we're about, is to give those kids that opportunity, those teens, so that they can move through and they can become adults. Maybe their depression's not cured. Maybe their anxiety is still present, but it's far more manageable. And they have a skill set to still thrive and be the best version of themselves. I know we're almost out of time. Any other questions? We want to respect your time. It's 10 to 11. Here to answer any more if there are. Otherwise, we're available to schedule individual consultations as well.
I just have one question, Jim. If a district wanted to work with you, what would their next steps be?
Great question, Lori. I would ask that they just outreach to me, email, and I can schedule a quick Calendly event to do a video chat via Google Meet or Zoom, whatever your preference is. And I can learn more about, the scope or the perspective of the school district and what their needs are, and start to formulate a cognitive understanding of that, and then bring in Panos and Dr. Lauren to sort of figure out, what's the best route. If I need to, speak to your cabinet or leadership, happy to do that, whether, be in person, if that's feasible, depending on where you're at in travel time, or if it's best via telecommunication, I'm happy to do that. But we're here to serve you. So I would just encourage you, if you're thinking about Dawn Health more than once after this call today, you probably should schedule something with me so I can answer those questions. And either you can put it to bed and know that it's not good, or we can move forward with a constructed, well-crafted plan to support your families and your needs that you guys know best. You know what's in your hallways, in your classrooms. Your teachers speak that loudly and clearly, and we want to be an advocate for them too. So yeah, reach out if there's any other questions.
And the good thing is too that because of our model, the way it is, and the partnership model that we have with schools and school districts, is you don't have to deal with budget approvals or budget cycles, right? Because there's no cost to the school. We want you to partner with us. There's, of course, your choice as to how you want to partner, right? And we want to help you understand the opportunities that lie ahead. And overnight, we can, making sure that we provide you with all you need, the information, so you can also inform the families that are part of your communities, so we can start thriving, as a community, not just individually as a school or as as an individual family.
Yeah, awesome. Well, any other questions or any other comments before we wrap up? Okay. Thank you. Thank you for taking time out of your busy day. Like I said, when we began, we know that that comes as an expense. And we hope that that expense was worth your time to learn a little bit more about Dawn Health. And please reach out. Our contact information is on the website for Dawn Health, and happy to follow up with you in any capacity. And thank you to MASA and all of you for supporting us and giving us some time here today. We appreciate you, Dave and Lori, as well. So thank you, everyone. Have a wonderful day.
Thank you all.
Thank you.
Bye.